So if you're running the FDA, Scott, should this change the way you think about vaccinating children and the speed and rapidity with which that gets done and the approval process?
Well, look, I don't think it necessarily impacts how FDA's approached this, because the FDA's taken the view that they want to make vaccines accessible to kids. They've approved vaccines down to age 12. There's vaccines in development right now, trials underway looking at vaccines at lower doses for kids younger than 12. So the agency's shown both a desire and a willingness to try to make vaccines accessible to kids. I'm not sure this changes the balance of the equation that they're using. Maybe it tips a little bit more heavily in favor of the risk direction, the risk to children. But I do think it should affect how we think about this from a public policy standpoint. I think trying to get especially teenagers vaccinated is going to be important, because the schools will become more focal points of spread, and a more transmissible strain that infects more children, even if it's not more dangerous, you're going to see more bad outcomes. It's just math that if more kids get infected, even if the rate of bad outcomes in kids is very low, more kids are going to have bad outcomes because more of them are getting infected. And we did see an indication of this in Michigan when we saw that big surge of infection in Michigan. It happened right around the time they opened their schools. And I think the consensus was among most people that the opening of the schools contributed to that big surge that we saw. The schools did become focal points of spread of B.1.1.7, which was the more transmissible strain. Now we have the new Delta variant, which is even more transmissible.
Scott, there are states like in Texas, as you know, that effectively have now made it illegal to wear masks inside schools. You remember the governor put that in place about a week or two before school was out at the end of this last year. Do you imagine that those rules should change for the fall? And do you imagine that students should be wearing masks indoors this fall?
Look, I think a lot of school districts are going to want to start the year, and probably should, with some forms of mitigation, whether it's masks or just some distancing and good, prudent practices within the schoolhouse. I think smart schools are going to start the school year with some form of mitigation until they figure out which way this goes and whether or not these models are right, because most of the models show an upsurge early in the fall. They show this happening in September with the new the new Delta variant. I don't think this is a risk for the summer. I think it probably is a risk for the fall. But I think the upshot is that we saw a very regionalized response to the virus for most parts of this epidemic. I think it's going to be even more pronounced now. I think there's going to be parts of the country that are relatively quiet, and parts of the country we see a lot of spread, and it's going to be dependent upon not policy decisions this time around, but how much immunity we have in local populations. And this may be a more rural phenomenon now as well. We may see more spread in rural parts of the country than urban parts of the country as we head into the fall, much like we saw in the Midwest.
Hey, Scott, one of the things with this spread in the UK goes back to, and we've had this conversation with you before, goes back to the idea that UK officials decided to give everybody one dose at first instead of 2 doses of these shots, because they wanted to make sure they got more of the population covered more quickly. Are we going to see a different sort of situation here? Because that's not the way we approach things.
Probably not. I mean, two-thirds of the vaccines that were deployed in the UK are the AstraZeneca vaccine as well. We deployed more of the mRNA vaccine, so I'll let people draw conclusions from that. But when you look at the overall vaccination rate in the UK and what they achieved in terms of full vaccination, they're about where we were, or they're about where we are, because they deployed vaccines, even though they deployed more first doses of the vaccines. By the time this started to spread, about an equivalent number of people were fully vaccinated as in the United States. If you look at what's happening in the UK, about 90% of the people who are hospitalized are not fully vaccinated. And the positivity rate is about 5 times kids under the age of 24, people under the age of 24, as it is in people over the age of 65. So this is an epidemic in the UK, and it looks like it's slowing right now if you look at what's happening there. So there are some hopeful signs, but it is an epidemic among schools, among younger people who are unvaccinated. Older people who are vaccinated are not the ones spreading this, and by and large, they're not getting as sick. So we've protected the vulnerable population. So the case fatality rate is way down, not necessarily because this is a less dangerous variant. We don't believe that that's the case. The case fatality rate's down substantially because the people who would succumb to the virus are by and large vaccinated.
Shepard Smith here. Thanks for watching CNBC on YouTube.